Hi, as many of you know, my name is Abby Lampley, and I'm giving my patient perspective of motor and orthopedic outcomes after hemispherectomy surgery. At the age of 3, I started having seizures on the left side of my body and was diagnosed with Rasmussen's encephalitis. At the age of 4, I underwent a right-sided functional hemispherectomy to stop my seizures and save my life. When I had my surgery, doctors didn't know very much about what to expect afterwards, so they handled it by telling my parents that I would be seizure-free, but don't expect me to be able to do anything. Don't expect much from me other than that seizure freedom. And this left my family and me no idea what was possible for my future, nothing to go off of, and that was both very frustrating and very scary. My biggest struggles with my outcomes from my surgery have been physical. As a child, I struggled with my hemigait along with the lack of arm and hand mobility on my left side. My left leg swung outwards and my foot dragged constantly, which gave me a whole lot of problems that I still have now. My left arm and hand haven't worked since I had my surgery, and with having increased muscle tone and spasticity, it made them difficult to move, so I had to learn to compensate and function one-handed. But there were no resources to tell me how to do this, so I had to figure everything out on my own. By the age of 14, I had completely quit all physical therapy because I was bored and wasn't seeing the progress that I wanted to see. My dad was someone who thought that I would be completely normal after surgery, which is unrealistic. At the age of 17, 3 years after I quit all physical therapy, I ended up in the hospital due to constant clonus on my left side, and my left knee was so unstable that I wasn't able to hold myself up without the knee buckling and causing me to fall. I would fall anytime between 2 to 10 times a day for at least 6 months. And from there, I got sentenced back to physical therapy. And I've been going to therapy regularly for 4 years now and am a strong advocate for the long-term care of the hemi side because I've learned without it, new issues arise and old ones come back without having the solutions to go along with them. And there has to be some sort of solutions, especially the longer you're out from surgery. Since returning to physical therapy and being fully committed to taking that time to better myself, I've been able to gain more control over the muscle spasticity and clonus on my left side. It's still there, but it's less as long as I'm doing what I'm supposed to be doing. And I've lessened my hemigait and the foot dragging as long as I'm not overly tired and I continue to wear my leg brace. I wear a plastic AFO to control my ankle and everything. But so I'm learning things to help maintain my mobility. My left knee is still really weak, but I'm working very hard with my physical therapist to strengthen the muscles around my knee and my hip because she thinks that the instability is due to using those muscles for so long, either improperly or not at all. You don't know, you can't fix what you don't know. And I'd been learning everything on my own and not doing anything. So that's why that happened. But as an adult, I still have the same physical struggles that I had as a child years after my surgery. But the difference is that I have help and I have resources that are helping me to learn how to maintain and compensate what I do have to keep as much mobility and functionability as I can. I am 22 years old now, almost 18 years post-op and 18 years seizure-free. And I'm very grateful for that. Having seizures return is a very scary thing. And I've had a lot of successes since my surgery 18 years ago and have overcome a lot more than just my physical struggles. But 3 of my biggest triumphs that I think I've had since surgery are that I'm now able to live completely on my own, and I have a job that I love and that I'm valued at, and I get to help people. for, and I graduated high school at the top of my class in 2.5 years rather than 4, despite different obstacles that I had. Thanks to my surgery, I'm able to live my dream of being an independent and functional adult, which is something that I wasn't sure was possible for someone like me, because there's nothing to go off the majority of the time that I was going through everything. Of course, that changed when the Hemispherectomy Foundation came about when I was 12. I didn't know what was possible, so I fought so hard for that because I wanted to go above. I am in long-term recovery of hemispherectomy surgery and wish I could go more in depth now about every single piece of my physical struggles, because there's a lot that go into one another. But I don't have time to explain what that looks like. I will end by saying that I believe everything can be traced back to my original struggles with my hemigait and the lack of arm and hand mobility, along with the lack of physical therapy continuously through my teenage years. I stopped therapy for 7 years, and what you don't use, you lose. And that's a big thing. That's part of why I advocate for long-term care, even if it's not fun. However, I am always happy to go into further detail anytime about what I've been through, whether that's in person or via phone call, text, Skype, or email. I'm around. I live in Alaska, so I don't get to see everyone as often as I would like, but I'm on Facebook, and I'm always happy to help and try to use my experiences to make a difference. So that's short, but thank you everyone for giving me the opportunity to talk and share a little bit about my outcomes and my experiences. I hope it helps, and I'm around for questions anytime. So, thank you.
Wow, how can I follow that? My name's Ray Woo. Thanks for inviting me to come. I'm a pediatric orthopedic surgeon in Orlando, where we have a large epilepsy surgery program. They've asked me to speak about this, and you know what a tremendous testimony, Abby. It really does work well with my talk, which I had no idea was going to follow your testimony. When I started looking on the internet about orthopedic outcomes following epilepsy surgery, I got nothing. Zero. In fact, I'm looking for something which doesn't exist, just like this guy with a lawnmower. That's a problem. I started searching orthopedics and hemispherectomy, 0 results. Hip, 0 results. Hysterectomy and spine, scoliosis, 0 results. Nothing. There's nothing in the published literature, at least in Medline PubMed, on orthopedic outcomes following epilepsy surgery. There is a lot about motor outcomes and epilepsy surgery, and there are a lot. Now, there are some limitations to this. A lot of these articles are actually on non-humans. There are some cat studies, some mouse studies, some rat studies, and monkey studies. And not a lot of this data is new. In fact, some of the newest articles I saw were 2013. It hasn't been actually any real research published, readily available since I can see 2013. And a lot of these articles with children had very small groups of children, maybe 30 children at the most. So there's not enough data out there to make any sound principles, and there's really no clear consensus at all in terms of a lot of this. So there's a lot of fertile ground here for research. So most of the research actually has functioned, has specified on children who've had motor impairment before surgery. There's not a lot of studies. There's no studies on kids who had no motor impairment before surgery. Mostly kids who had hemiparesis, which is weakness of one side of their body, increased muscle tone, and then decreased range of motion. And you'd think that, well, the outcome is going to be the mirror of that, which is going to be what is the outcome in terms of their spasticity after surgery, their ambulation status, and how weak are they in their affected side after surgery. And that's, by and large, all of the data there is. So we do know that in half of the children, they're actually more profoundly hemiplegic or hemiparetic after surgery. And the arms are more affected than the legs. And in the arms is usually the wrist and fingers which are more affected than the upper extremity. which is a big problem. Now, let's talk about ambulation. Ambulation is not necessarily walking. Ambulation is just being able to be independently able to move on your own. It doesn't mean that you're walking without aid of use of crutches or braces. But ambulation is very important. And almost all the children who are ambulatory before surgery remain ambulatory after surgery. But 25% of those children who were not ambulatory before surgery were able to ambulate after surgery, which is remarkable, actually. But none of the data actually tells us how long after surgery should we hope for that to happen. There is no data for that. There is no timeline. So when parents say, well, how long should we continue to strive and hope that our child begins to walk? I don't know. There is no outcome for that. Arm function generally is worse for about 1 to 2 years. I mean, Abby, correct me if I'm wrong, after surgery. And more so, it's the wrist and the hand, which is the last and most difficult part to come back. And even though spasticity in the wrist and the hand is worse, actually the functional use of the hand and the wrist is actually better after surgery, despite that, according to the data in the literature. So better motor function is assumed to come if you have better seizure control. And people think that if you have continued seizure activity after surgery, what happens is that the gap between your chronologic age and your developmental age continues to widen, so you get more and more delayed. You continue to have seizure activity after surgery. However, there's another gap. Nobody's ever investigated the effect of seizure medications in those kids who still need medication after their surgery because they still have seizures. Surely, those medications affect plasticity. Dr. Cole talked about some of those medications like valproic acid, which affect plasticity. Nobody's ever did a study on that, at least I can find. And Dr. Cole, maybe you can correct me if you can, but I couldn't find anything in my studies. Definitely, there is some correlation between the cause for your seizure disorder and the outcome. It seems that folks who have hemimegalencephaly have a worse outcome, worse hemiparesis after surgery, and those other causes are better. Now, cortical dysplasia, 40-50% of those kids actually have much better function of their weak side after surgery. But there's a lot of ambiguity in literature in terms of whether or not it's better in those kids who've got Rasmussen's encephalitis or folks who've had a cortical stroke. So there's no real agreement there. Also, there's no agreement as to whether or not your skills will be better, depending upon your etiology, but it's thought that those children who have more of a acquired etiology have a better outcome, as opposed to those kids who have a more congenital etiology, like hemimegalencephaly. So there is some data, though. How long will it take for your skills to improve? Well, your skills will improve for up to 2 years after your surgery. We do have that kind of data. However, as Abby had said so succinctly, sometimes it doesn't ever get better, especially in the wrist and the hand. There are some prognostic factors which lead you to have a better outcome after surgery. Namely, how long have you had seizures before you had your surgery? How far along were you in your motor development before you had your surgery? And how young were you? And it seems like the magic age is sometime less than age 10. And I guess most of the literature has focused on children who've had surgery between ages 2 to 10 years of age. I know there's some children who have it as young as 18 months of age, but that's most of the data out there. So in summary, the motor outcomes, not the orthopedic outcomes, but the motor outcomes are influenced by these factors. And the ideal patient for surgery, as far as I can tell, will be those children who are fairly advanced in their milestones before they had their surgery, had very little affected hemiparesis before their surgery, and had a very short seizure history. But again, there was no data for orthopedic outcomes. Now, if you listen to what Abby said, Abby didn't talk about her motor outcomes. She talked about real functional outcomes, real physical outcomes that affect her daily. Those are the orthopedic outcomes. So my challenge to you is I gave a talk about nothing about orthopedic outcomes. The issue is that I think we've missed the boat on this. There are some side effects which haven't been studied. There are some effects which haven't really studied, and we don't know what the needs will be for children who've had a surgery as kids as they get older. So, Abby, I'm interested to know what's going to happen to you in 10 years, and 15 years, and 30 years. Nobody has that longitudinal data at all. And of course, I don't have any information to give my parents in terms of what orthopedic things they should expect if they consider having their child have the surgery, and what information they should have to help their child recover from the surgery. That information doesn't exist at all. So I'd like for you to think about, what would be the most challenging orthopedic need that you experienced. I'm talking about patient stakeholders here, when you're helping your child recover from the surgery. That's my task to you. So we do have some references here for your information, and thank you so much.